Hi, everybody. Today we're going to have another podcast, and our guest, our dear friend, Dr. Joy. Dr. Joy.
Hi.
Thank
Good
you.
to be here.
Thank you. As usual, first question. What's going on that you become a dentist? What's happened?
Why did I become a dentist? Oh my God. Okay. So, braces.
Oh,
Your
braces.
Yeah, my
Wow.
braces. I was like this.
Wow.
Because I used to suck on these two fingers. Not my left hand, my right hand. These two, through the age of 9.
Oh my God.
And not from lack of trying on my parents and my dentists. I mean, they tried so hard to prevent me from doing this. And I was a good kid. I did my homework. They did, the hot sauce and then the bad nail polish and a mitten, like the whole kit and caboodle. Well, Mrs. Nutting, my 3rd grade teacher, was very scary. And I remember like one time in class wanting to soothe myself by sucking on my fingers. Oh yeah. So the damage was done. I had pushed my teeth out. And so my parents, both of them being teachers, they had to save money in order for me to have braces. And I will never forget my orthodontist, who was a wonderful man. But I got in at 12. And he turns to my mother and goes, I wish I saw her 2 years ago. Now everything is set.
That's it.
And my mom had tears in her eyes because at the age of 10 is when they started to save money for me to have braces. And now they had enough money. So it broke my heart. It absolutely broke my heart. And I'm like, at that point, I'm like, I want to be a dentist so that I can hopefully never have that happen to another patient, to a child or anybody for that matter. And I also wanted to be able to provide, care for someone. And this was, I thought, the perfect way of doing it. And he was great. My orthodontist turned out to be fantastic because he would bring down different study models, totally against HIPAA now, right? But he was like, oh, who's your best friend? Because he treated my entire high school. And he's like, who's your best friend? I'm like, Tracy. He's like, oh yeah, I know her. And he would show me my mouth and her mouth and how it was changing. Blew my mind.
And after that, you decide that's it.
That's it. I want to be a dentist. But
why you become not orthodontist? Why you become?
Okay, so true story. It's freshman year, first semester of college, bio major, right? So us bio majors, we're all nerds. We're Friday night, we're sitting around talking about our futures. True. So, we're going around. I'm like, I'm biology. I'm, pre-dent. I want to be an orthodontist. Everyone laughed at me. Wow. We're talking like 8 other people in the room. I'm like, what's so funny? This guy over here was like, oh yeah, I used to fling my rubber bands across to my girlfriend, across the classroom. This guy over there was like, oh yeah, I told my mom I went to the orthodontist. In actuality, I was playing basketball with my friends. And I'm thinking to myself, even before I knew I could get into dental school, I'm like, I'm going to have to deal with non-compliant kids and their parents on top of it.
You're right.
Absolutely not. I want nothing to do with that. So general dentist for me. I mean, I'm not making nearly as much money as an orthodontist would, but what's so great is that I do clear aligners for adults. The children that are going through growth and development, I leave that to the orthodontist. They've got the extra training. But for those that, had braces as kids and never wore the retainers and they still have that snaggletooth, guess what? I'm yours. I will fix that for you. No problems.
What school did you go?
I went to Marquette undergrad. I wanted to be in an urban environment and it had a dental school on campus. So I really wanted to make sure I made the right choice. I got to sit in on a couple of courses. But I wound up not going there. I wound up going to NYU for dental school. And I did a year residency in Brooklyn, general practice residency. And it was a fantastic experience. I was in New York for 6 years.
And you originally around here?
So born in the city, born in Chicago, and then raised in Park Ridge.
Wow.
Yeah.
Beautiful.
It was great.
Oh, beautiful. And I know now you don't want to be orthodontist, you become GP, but you have some little, I read it, you have some little specialization like geriatric. It's so rare because I never even heard about it in dentistry. Yeah.
So I have my grandmother, she really needed a new lower partial denture. And she was homebound.
Long time ago.
Yeah, this is 2007.
Okay.
And she needed a new lower partial denture, and she just couldn't make it to a dental office. So I made her a lower partial denture, and I adjusted it with the Dremel. We sterilized the drill bits, and did that. And that Sunday, the one place she would go every week was church. So she went to church with my Aunt Mary and my Aunt Joan, and I get a frantic phone call later that day from my Aunt Mary saying, we wheel Grandma in, and she announces to everyone in her Ladies Guild luncheon after Mass that her granddaughter, me, makes house calls. And I'm like, oh, Aunt Mary, don't worry about it. It's no big deal. That's so sweet. You know, it's a huge compliment, whatever. Because this was, I love you, Grandma. Happy birthday, Merry Christmas, Happy Grandparents' Day gift, right?
Yeah.
We kind of lied to her. You know, we're like, oh yeah, Grandma, I do this all the time. I'll just add you to my docket. Because she never wanted to be a burden on anyone.
Okay.
Got 6 phone calls the next day. And that's how this whole thing started.
Wow.
And so now I go to 18, 19 different nursing homes, which are long-term care facilities. So that would be anywhere from assisted living, memory care, skilled nursing. And I have a practice on the north side of Chicago. Yeah, it's really grown into be something really special. So you will never see me doing a root canal, but I will do dentures all day.
Wow.
Yeah.
It's so rare because not so many dentists love, not even technician loves to do removable.
Yeah.
And nowadays, I know, nowadays different generation because people has more money, a lot of people. That means they can do not remove, they can do like screw retain.
Yeah.
But it's, 20 times more expensive.
Absolutely.
Not everybody can afford.
Well, it's not only that, but whether or not people can afford it. It's whether or not they can actually get the denture or get the implants.
Okay.
Because there might be some, comorbidities that they have. Like, for example, if they have a history of multiple myeloma, bone cancer, if they have had some other, issues that will prevent them from getting dental implants just, physically or medically. Then the only thing they can get is a denture. And then you've got some people that have just straight up dental phobias.
Oh.
Right. So they're scared of dental implants because they had, their neighbor or a loved one, whomever, cousin will have had a horrible experience with an implant, for example. Let's say back in the day, it sticks with them. Oh, you don't want a dental implant. You don't want that.
Yeah.
You know what I mean? So you've got fear, you've got potential medical conditions, and then yes, you've got the financial component too. But there can be a myriad of reasons why they're not going to be getting dental implants.
But sometimes people have some condition that they don't have enough special law. They don't have enough bone to even wear a denture, right?
Exactly. Yeah. What do you do then? Especially if they've been, if they've had, let's say, for example, they've had dentures for a while or partial dentures and they're holding on to those 4 teeth.
Yeah.
And those 4 teeth still don't have the proper foundation.
Yeah.
What are you going to do? Or then what happens too? The sinuses, especially on the upper, the sinuses will begin to sag.
Yep.
There's only so much bone you can put in there, right? Especially vertically. So if you can't put the bone in,
that's it.
Exactly. You're done.
How you become, I know you're teaching too. What the purpose was for you to teach young students to know more like older people?
Great question. So, well, I think my teaching gene got turned on because both my parents are teachers. And so I do love to educate. I love to educate my parents first, my patients, and now students. So I teach. I'm an adjunct professor at UIC Dental School. The second years come with me to a memory care, long-term care community, so they can learn about the different types of dementia in action. And then I also have the dental students third year class. They will come to me as a rotation. And they will spend a morning with me working on the older adult because a lot of my patients are older. They're older. Right. And so they get to experience different things. They get to see how the older mouth, what happens, the signs and symptoms of an older mouth. You're going to see a collapsed bite more often. You're going to see more abfractions. You're going to see more class 5 caries. You're going to see, different things that you're going to see, on a 30-year-old, for example. And also, the medical history is also that much more important as well. What medications are they on? Are they diabetic? How long have they been diabetic? Do they have high blood pressure? Different things. Dry mouth. All of these factors really play a part in how the mouth is and the condition of the mouth, and then what kind of dentistry can we do for those types of mouths. And then in the fall, I'll have the fourth years coming in, also do a rotation with me as well to treat the older adults. They're trying really hard to expose the students to not be afraid of treating the older adult.
Yeah, because it's hard.
Because it's hard.
It's
It
so
is hard because there's
Kids
a lot of
and
background.
older adults. Yeah.
Yes, exactly.
yeah.
Yeah. I mean, children are a tough crowd as it is for their own reasons. But when you have the older adult, especially when the older adult still feels that they're alert and oriented, but they may not be.
Exactly.
That is really tough. And so you have to, now it takes a village. Now you're working with the caregiver who potentially may or may not be driving them, but they may not have a say in what kind of dentistry you can do for them in the treatment plan. You can have a medical power of attorney. You can have a financial power of attorney. The medical power of attorney may say, yeah, go ahead, make that new denture. The financial power of attorney might be like, can we just reline it? Can't we just use adhesive? And I've learned my lesson. I've been burned a couple of times because who I thought was the one really in charge of, because it really comes down to the financial one. Let's be honest. Let's be honest. It comes down to the money. So who I thought might have been the right person was not. And now, fortunately I wasn't sued, but at the same time, we don't know what we don't know. So making sure we have all our ducks in a row before we treat the older adult, medical histories, all that stuff, a med list. There's a lot of work involved. And also too, what we try to do too is we try to say, okay, so let's say the appointment's at 1:00. We say the appointment's at 12:30. Why? Because now they're walking in, God bless them, they're walking in with their walker at 1:00. And they want to tell Diane, my front desk person, how beautiful her hair looks. And they have to use the bathroom. And so by the time they get into my dental chair, it's now a half hour in, right? Because they have to say hi to all the dental assistants because they haven't seen them, right, in 3, 4, 6 months, depending. So we say the appointments half hour ahead of time so that at 1:00, their tush is in the chair and I can actually do dental work for an hour, hopefully.
But we're talking about the office. How about if you go into nursing home? How does it work?
How does that work?
Yeah.
So what I need is permission from the family. The nurse may say, I notice, I'm making this up, bad breath from one of their residents. So then I'll get information. It's called a face sheet. I'll get a face sheet with the particulars of the patient, also with the medical and or financial power of attorney. We call them. Fortunately, in Illinois, we don't need anything in writing because I'm an independent contractor.
Okay.
The nursing home X. So the residents at X are their patients. I just come in to treat, right? But the responsibility is ultimately on the home. Okay. So I come in to do, dental work, but we call the family and, yay or nay, we discuss finances, and then I will have like a book of patients. So I'll have 3, 4, 5 patients same day. So I'll, if it's a continuing care home, meaning if it's assisted living, memory care, skilled, I'll see some patients in each. And then, I'll treat them, do what I need to do. I have my bag of tricks, if you will, doing a lot of SDF, doing a lot of, fluoride treatments, doing a lot of, cleanings, obviously, and exams, but I'm also there to help. Too? I don't use a Cavitron, right? I'm hand scale. I do a lot of hand scaling. But to be honest with you, that's what these patients are used to anyway, because once again, older adults, right? Cavitron is still relatively new for some people, especially in rural areas. And also too, with my memory care patients, meaning the ones that are living with one of the dementias, they don't like that vibration feeling. They don't want excess water in their mouth. They don't know what to do with it. And so now they're going to be like this, and now they're not going to let me into their mouth, right? So I want to make sure that I'm doing something that they're relatively familiar with. There's still a memory path, if you will, timeline where they can remember where they had been cleaned before, so I'm trying to invoke that memory while I'm cleaning their teeth. But I also want to make sure I do a good job. So I'm hand scaling, and it sometimes takes me a while. But for some of my patients that have advanced Alzheimer's, for example, I'm just using a toothbrush at that point. I'm doing the best that I can with what I have for them.
They're not doing it all.
They're not doing it at all. They don't remember that they're supposed to do this. They don't recognize a toothbrush anymore. But what I like to do is I don't want to be doing this, let's say, in the beauty parlor. I don't want to be doing this in maybe the medical consult room. I want to be doing this in their room or in their apartments. Why? Okay. Because those that are in early to mid stage, I'm going to bring them to their bathroom. And then I'm going to say, where's your toothbrush? I don't see it. Can they recognize their toothbrush? Oh, it's right over there, but I can't reach it. Okay, fantastic. Oh, toothpaste. Where's the toothpaste? And then they'll show me the toothpaste, or they're like, I don't know. And they're looking right at it.
Wow.
That is information right there
I never knew
where I
about
can
it.
communicate with, the caregivers. I can communicate with the
Yeah.
family. I can communicate with the nurse and be like, okay, Sally is no longer recognizing her toothbrush and toothpaste. The care plan needs to be changed. Now you have to give them the toothbrush and now you're putting the toothpaste on them.
Wow.
There's been a decline.
Uh-huh.
So there's a lot of information you can get when I'm treating them in their actual home.
Wow.
And two, this is where they're most comfortable. I'm a guest in their space. This is their home. And so they're going to be the most relaxed in their own room and where I can probably provide the best treatment.
Yeah. But usually, as you said, the kids come in too, just to...
The kids aren't always there.
Not always there.
No, they're not always there. They're going to want, they might want to be there for the first appointment to meet me, see what I'm like, see what I'm going to achieve. After that, then it's usually just a phone call, email, my findings. Yeah. And so then what I do at the end of the day, I will, based on room numbers, because I'm always HIPAA compliant, I will then email the director or assistant director of nursing, room 203 NSF WNL, meaning within normal limits, no significant findings. So I haven't found any abscesses. There's no inflammation, no loose teeth, no mobility, stuff like that, no cavities. And then I'll also, call the families on site. First of all, I want to make sure that they recognize the phone number so they'll actually pick up. Do you know what I mean?
Yeah.
And then I can have a conversation right there. I forgot something, fix my email, stuff like that.
Yeah.
Or I can, change the email saying, okay, family said, yes, you can go ahead and do the SDF, the silver diamine fluoride for, the tooth numbers that I found that have root caries. So stuff like that. And that's, my day. I'll see a certain book of patients in the morning between breakfast and lunch. I'll travel then to the next home, and then between lunch and dinner, I'm treating the next group of patients at another home.
But your week probably divided. Some days you're in nursing home, some days in the office.
Yes, exactly right. So Mondays, unless there's an emergency, I will spend all day in my office. That's our busiest day. That's my busiest day. And so I will treat my patients. And so, I've treated, as little as one, as old as 103, 104. The amount of centenarians that I have right now are numerous. I have a lot of patients over 100 now.
Really?
Oh my God, yeah. And a lot of them still have their own teeth. It's amazing. Yeah, they're fantastic.
But I can say, like 20, 30 years ago, it's probably wouldn't be possible.
No, wouldn't be
way,
possible.
Right? Yeah.
But these people are living their best lives.
Wow.
It's amazing. It really is amazing, and it's a pleasure to know them because they have such. I mean, I could sit with them all day and talk because they have such stories.
I can imagine.
Yeah, it's so much fun.
I saw in your business card you have last 3 letters CDP.
Yes.
What does it mean?
Certified.
Because you told me, I just
I know. No, so I'm DDS.
Yeah.
Fellow of Special Care Dentistry Association Geriatric Council, of which I'm on the board. And I'm a certified dementia practitioner. Yeah. And I did that during COVID because I was, worried. I was like, okay, so do I need to, pivot in my dental career? And this accolade is very popular, for lack of a better word, in the nursing home community. And so I became a certified dementia practitioner. And so I can walk down the hallway and I can be able to differentiate, oh, that person has Lewy bodies. Oh, that person has Parkinson's. Oh, that person has Alzheimer's. Oh, this person has, because of that certification, it's just, I can tell right away. And then how I treat them is going to be different for each patient. Because
to me, like dementia, it was the dementia and Alzheimer's. But now you told me dementia, it's like a umbrella of everything.
Yes.
I never knew it's so many different.
There's, So top 5, Alzheimer's, Lewy bodies, frontotemporal, vascular, and Parkinson's, right?
Wow.
So Alzheimer's, Ronald Reagan, right? Lewy bodies, Robin Williams. He wound up unfortunately taking his life because of the hallucinations he was having in his brain. You don't get that with any of the other ones. Bruce Willis, frontotemporal dementia, trauma. They think it was from all the stunts that he did, back in the day. Vascular dementia, stroke.
After that, you can have like
a very vulnerable part of the brain is memory. That is going to be one that can be damaged irreversibly, the most common part of the brain. And then Parkinson's. Parkinson's can be from a multitude of reasons. Michael J. Fox, they think it was from just excessive drug use. That's what they think.
Mhm.
They're not really sure. But he was like, what, 38, 39?
Yeah.
When he first was diagnosed? I mean, almost unheard of. But yes, so these are the ones. Now, with Alzheimer's, 60% of the people that have Alzheimer's have a gene for it. It's APOE3.
It's mean like a generation to generation.
Yeah.
Wow.
So there's a familiarity with that, familial lines. So for someone who has, and I cannot encourage this enough, if you learned nothing else from this podcast, I strongly encourage you to get the blood test. So yeah, and if you have a family member in your direct line,
Right.
so we're not talking cousin, we're not talking aunt,
parents, grandparents,
so on and so forth.
Okay.
If someone else in the family direct line have had it, then the insurance will pick it up.
Wow.
And get the drug test. Please do, because
and it's going to show you what?
It's going to show you if you have the gene or not. It doesn't necessarily mean that the gene has been turned on.
Okay.
But it will show you that you, just like the breast cancer, BRCA, the BRCA gene, doesn't necessarily mean it's been turned on, but you will now have a higher proclivity to get breast cancer. Same thing with Alzheimer's. And so what they're trying to do now is, and they're working really hard, in billions, trillions of dollars, worldwide. They're all working so hard trying to work with gene therapy now to keep the gene turned off.
Oh, interesting.
So that's what they're doing. There are medications that all that does is slow it down, if it even works in the person, because not every drug works for everybody. But yeah, but 60% of those that have Alzheimer's, specifically Alzheimer's, have been diagnosed with Alzheimer's, have a gene for it.
And you told me about dementia. That's mostly it's from inflammatory, right, in your body,
chronic inflammation.
It's for me it's like, oh my god,
chronic inflammation. Well, because it wreaks havoc on the immune system. The immune system is fighting so hard to control any insidious bacteria that can invade our bodies. And I'm a dentist, so I'm going to specifically know about the mouth, right? So the most common cause of chronic inflammation is gingivitis, and over 85% of the world population has it. So the immune system is constantly fighting so hard to control the insidious bacteria that cause that inflammation, that eventually over time wears out the immune system. And it's going to try to seek energy from other parts of the brain. And once again, the most vulnerable part of the brain is memory. And yeah, I'm kind of dumbing it down a little bit. There are pathways that show this, but that's what it really comes down to. And it's the earliest memory, or the latest memories, the most recent memories that go away first. Like, you're just going to continue to want that same thing. And I was so disappointed. I thought because I didn't have a sweet tooth, I was never going to get a cavity because I don't like sweets. I could care less. If I never have ice cream again,
no, it's not even chocolate.
I don't care. Sometimes, occasionally, I want a piece of like maybe apple pie. If it's at a restaurant and it's being served.
It's not like addiction,
No,
because I can eat chocolate like
really
chocolate. Dark chocolate.
Dark chocolate? Yeah. Well, and dark chocolate is so good for you, right?
I know.
So good. Anything over 70%. Yeah. But when I was in dental school and I found out that it was all complex, all bad carbs, like including the salty stuff, the savory stuff, I'm like, really? Here I thought I was one of the good people. But no, our salivary enzymes have not kept up with our modern diets. They can't break those foods down as well as they can broccoli or an apple or protein. They just have not kept up with our modern diet. So because of that fact, we tend to get more plaque. And because the bacteria are kind of like, well, okay, I'll eat this, but we tend to have more residue in our mouths if we're consuming those types of food. And then so we have more plaque, and more plaque means more bacteria, and more bacteria means more chronic inflammation, and it just becomes a circle. It becomes very circular. I know, doesn't it stink?
Okay, let's forget about this.
Okay.
Yeah. Not only this, what do you like? What's your hobby? If you're gonna forget about dentistry,
you're gonna laugh at me because I am a nerd. I love to travel, but I also like to combine travel with learning. So if I could do like every single possible dental conference, like I would just go to them all. I would just love to do that and just keep up with education that way, but also go to a new place. Like I just found out that a colleague of mine, she just presented at the Oregon Dental Conference. I'm like, oh, that sounds like so much fun. I want to do that too. This week I'm going to Dallas, going to visit some family, but I'm doing a dental conference. I'm speaking at one. Next week it's Kansas City. So I like local. I like Midwest. I'm speaking at the Midwest Dental Conference next week. So I'm really excited about that. going to Orlando in June, speaking at the Florida Dental Conference, going to San Jose, California in August, speaking at that one at the Bay Area Dental Expo. So yeah, so I love to incorporate travel with speaking engagements, but also I love to just, have this, to talk to people in the dental industry, learn, because I'm always learning from someone. I love it. Wow. But then I also, would love to travel to overseas. One thing I have not done yet, I have not been to Central and South America. My cousin has done a bunch of that. And so I really want to just pick her brain. And I don't care. Like
Mexico, Brazil.
Well, Mexico is Mexico, but we're going further down. So Costa Rica, Brazil, Peru, Chile.
Argentina,
I really want to go to those countries. It's on my short list.
In my mind, I think we're gonna need at least 3 more podcasts. At least 3, because I have so many questions, but because I know people, nowadays, especially I know for my kids, they can't listen so long. They have to time.
Oh, it's true. That's why TikTok is so popular.
Exactly. This means we need to figure out our next podcast, because we can talk for hours.
Yeah.
Yep. Okay. Dr. Joy, it was my pleasure. Thank you so much. And we'll see for sure.
Yeah.
Again,
I look
it's not far from you, right?
No, it's easy.
Perfect.
Yeah.
Thank you so much.
It's my pleasure.